Hello, everyone. Shalom and good morning. I hope everyone can hear me. My name is Ofer Forer, and I'm the head of the Israeli Economic and Trade Mission to the UK. And it is my pleasure to host today's webinar focusing on optimal aging, preparing local authorities for 100 years of life. The emergence of better medical care, increased social support, and awareness to a healthier lifestyle result in an ever-growing number of elderly people living in the comfort of their own home. As local authorities need to allocate more resources to provide services for this very important and growing group, new challenges emerge of how to do that in an effective manner. Therefore, it is our pleasure to host in our webinar today specialists from local authorities spanning from Swansea in southern Wales all the way to Orkney Islands in northern Scotland. Our webinar today will focus on providing social care to the elderly population in an effective way. In order to do so, we have teamed up with the JDC, a non-governmental organization which runs such projects in over 70 cities around the world. In order to open our webinar, I would like to screen an opening remarks by the Ambassador of Israel to the UK, Her Excellency Tzipi Hotovely. Let me just share my screen and we'll start.
Good morning to those of you joining our webinar from the UK, and good afternoon to those of you joining from Israel. The webinar that you're about to join is focusing on an area that is particularly close to everyone's heart, the elderly community. Over the past 2 years, the COVID-19 pandemic has affected all groups in society. Among the many groups of people affected is the elderly community, an ever-growing group in our aging population, which has found the challenges of lockdowns and social isolation extremely difficult. As the spread of the pandemic wanes, thanks to an impressive uptake of vaccines and the professional care by the NHS staff, it is clear that the challenges faced by the elderly population should be a key focus going forward. The ever-growing number of elderly people living in their own homes means a changing demand on local authorities. A large number of elderly in Israel are living in their own private homes and are actively integrated in their local communities. This personal independence and active integration is a result of several programs that are carried out in Israel, as well as in many other countries around the world. These programs are led by groups such as the JDA, a non-governmental organization that aims to help city and municipal bodies to provide better social services for their elderly communities. I would like to welcome you all to learn from the best practices that we have to offer in Israel in order for us to be able to help more members of the elderly community in both Israel and in the UK. Thank you, and I hope you will enjoy the webinar.
Thank you, Ambassador Hotovely. And before we move forward to the professional content of the webinar, I would just like to add that should you have any questions throughout the webinar, feel free to ask them by using the Q&A box on the lower part of your screen. The JDA team will be able to answer your question online or refer to them during their presentations. I'd like to comment that the webinar is recorded and will be uploaded to YouTube. We will share with our participants the presentations which will be showcased today, and a link to the video. So now, without further ado, we will move forward to our first speaker of today. I would like to invite Mr. Yossi Hyman, CEO of JDC Eshel and former CEO of the Municipality of Jerusalem, for his session on JDC's model for optimal aging. Yossi, the floor is yours.
Thank you very much, Ofer, and thank you for all of you for participating us this noon. Let me share the presentation with you. Just let me know that you can see it.
Yeah, we can see it clearly.
Okay. So first of all, who we are. JDC Israel is part of JDC Global, which established in New York in 2014, 108 years ago. JDC Israel vision is to strengthen the Israeli society capacity to care for all its people in order to close social gaps and promote resilience and social justice. Operatively, and our mission is to promote innovative, efficient, and measurable system-wide solution for the benefit of vulnerable population and together with them. JDC Eshel is one of the 5 divisions in JDC Israel, and the oldest one. We founded in 1969. We are a governmental partnership. You can see here that our board of directors includes participants from the Ministry of Health, the Ministry of Welfare, the Ministry of Finance, the Ministry of Social Equality, and the National Insurance Institute. And most of the services for older adults which have developed in Israel and exist today in our older adult in Israel were established by a JDC Eshel with the government and with the local authority. So we are we have the longest and widest experience in research and in developing and implementing services for older adult in Israel. Our mission is to improve the well-being of vulnerable older adults in Israel by advancing their autonomy, functionality, and independence. Few words about life expectancy in Israel. I'm sure in Britain, in England, it's more or less the same. So when we talk about numbers, in 2015, we had 1 million people from 65 and above in Israel. 13% of them were 85 and above. In 2040, it's going to double itself to 2 million people, but not less important is that the percentage of age 85 and above is going to increase to 18%. 25 years later, it's going to be 3 million older adults from 65 and above, but 24% of them are going to be 85 and above. And it means that the number of older adults with functional decline are going to increase dramatically. And here you can see from 10% in 2020 in a very short time to more than 40%. And that's data has a huge effectiveness of all parameters in the state of Israel. 7 months ago, in July 2021, we have succeeded to have a governmental resolution. It's number 127. For those of you who want to get into this resolution, you can enter into the chat, get into it through the Google. The government of Israel got a decision about the dashboard for optimal aging, dashboard for change. We have studied from more than 100 researches and surveys include, I'm sure you know, you're familiar for the ELSA, the English longitudinal study of aging, and the share surveys and others. So we bring this dashboard to the government, and this dashboard, this indicator for optimal aging include 6 indicators. 2 of them belong to the family of health, healthy lifespan, and functionality. 2 of them for the family of meaning, loneliness and quality of life. And 2 of them related to the family of economic resilience, which is disposal income and ability to cope in unexpected needs. And we have another level of this map, which we have 80 predictive indicator for optimal aging. Here you can see just 12 of them. Again, related to families of financial capabilities, active lifestyle, healthy lifestyle, health management, and digital literacy. One example from active lifestyle, employment 28%. It means that 28% of the people in Israel who are 65 to 75 are still employed from half to full employed and get salary for that. And we want, of course, to increase those indicators in the future You can see here the color. The color here are the situation in Israel compared to the OECD. If it's red, it means that we are in the third level, the lowest level. If it's green, and there are some green here, it's above the average of the OECD, and yellow, it's similar to the average of the OECD. And the full map that we work with about is in JDC Eshel, our strategic roadmap to promote optimal aging in Israel. When we define the impact is to increase the independence for older adults. So this is the first level. The second level is the national indicators. And the third level is the operative way to promote the roadmap for promoting optimal aging in Israel. We have here 8 LSI, large-scale initiative, which we call LSI. 5 of them strive to improve the individual level, health management, quality employment, digital literacy, social involvement for those who lack social netting of a family or the community, retirement preparedness, and 3 of the LSI strive to improve the system level, the nursing care system, the city or the municipality system, and the housing system. Today we are going to talk about the age-friendly city, or as we call it, Muni 100. Why do we call it Muni 100? Because from 4 years ago in Israel, every third child who gets birth is going to live more than 100 years. And we think that the government, the state of Israel, and the municipalities are not ready for that, and we want to promote it. And here we come to the Muni 100. So the rationale of this large-scale initiative is that as much as a person getting old, the nature of his behavior is to stay more at home and in his room, his bedroom. But we know from all the researchers that as much as you take out the person from his house, from his home, outside to the public sphere, to the neighborhood, to the town, you improve his situation. That's why this Muni 100 strive to pull out the person and get him outside from his home as much as we can. Of course, the first factor who take the person out from his room is the person itself, if he has motivation, or maybe his family or his friend, which motivate him to get out from his bedroom or from his home. But the second factor, important factor, of course, is the municipality, the city, which influence in many aspects the life of the person. And that's why we define the goal of this large-scale initiative to increase the presence and the participation of older adults in the local authorities' physical, of course, health, include health, social, and financial spheres. We defined 7 metrics, 3 of them in the individual level and 4 of them in the system level. So the first metric is mobility. We wanted to see the person get more and more out from his home as much as we can to improve and to increase his mobility. Sub-metric of mobility is walking outside, because walking is a very, very important element for older adults. That's why we put it as one of the metrics of this LSI. And participation. We want to see the person take part of as much as need or can take part in events in the public sector. And metrics of the local authority level, in the system level, the first one is physical accessibility. We understand that if the physical sphere around his home is not going to be comfortable, is not going to get out. Financial accessibility, we don't want that people who don't have enough money for basic events in the municipality prevent themselves to be part of it because they don't have enough money for that. We know that in Israel, about 45% of the older adults, 65 and above, have problem in being and knowing the information because they have digital orientation problem or others. That's why the third metric is access to information. And last one is social access. People should feel good in the events and the social activities in the municipality. These 7 metrics, the full map of indicators include 14 indicators. You can see here the main 7 metrics. Some of the metrics or some of the indicators is what the municipality report, like subsidizing municipality event for the elderly. This is something that the municipality should report about it. Some indicator we are going to collect by asking the older adult or their family, their family, like sense of belonging and security in the public sphere. We want to ask you through surveys if you feel good or if you feel belong or none. And some of the indicators, we are going to measure them by very smart and new tools, like this indicator proportion of senior citizens that walk a daily average of 3,000 steps a day. So it's the all maps, and every municipality is going to build its own program, because each municipality and each city is very different from each other. Why this age-friendly city model is so innovative, and we think and we assess that it's much advanced, that the oldest age-friendly city, which we have studied a lot from it. First of all, it's give a response to a developing national and global needs to increase of life expectancy. We have a common metrics between the municipalities, but different strategic plans and goals for each municipality. It allows each local authority to develop a unique plan in accordance with their capabilities. We are going to examine the actual impact, something that in Israel we don't do a lot, and we want to improve our services. We are going to accompany through the planning and implementing stages by consultants that we are going to train in JDC Eshel, but we're going to enable the municipality, those consultants. We are going to use a technology that were not available in the past, and we are going to measure it near real time. We are going to use big data tools, smart analysis of GIS layers, and street photography. We want to enable the cities to have a smart map which mark all the street in red, yellow, and red, yellow, and green, as it for walking and being of older adult in outside, and advanced questioning tools. What are our milestones? We are going to go with the RFP in 2 months from now. We are going to select the local authority, the municipality, for the pilot. We want to get out with 20 municipalities. We are not sure that we have all the money for that, but we strive to go to the pilot with 20 municipalities. Then we are going to enable 1 year to the municipality to build its own plan with the consultant that we are going to enable them. And then in 3 years, from 2023 to 2026, we are going to the phase of implementation in the local authority. And from 2024 and onwards, we want to assimilation and expansion in additional local authority. We have a very, very aggressive or ambitious plan to bring all the municipalities in Israel in 5 or 6 years into this plan. And I really hope that we can have it. we are going to send you the presentation, and you have here my email address, so you can contact me in the future if you like, and we want to have a cooperation with with some of you, to share knowledge and to study and have a lesson learned from you experience. And after me, Sharon Melamed is going to talk. We have just started a pre-pilot in Tel Aviv, and Sharon is going to share with you some of their experience from that. Thank you very much, and maybe if we'll have a question, I'll answer it later. Thank you.
Thank you very much, Yossi. And as Yossi mentioned, should you have any question, you would like to have more information, please use the Q&A box, and the team from the JDC will be happy to respond. So as Yossi mentioned, going into the more practical level, I would like to invite Ms. Sharon Melamed, Head of Social Services Administration of the Tel Aviv-Yafo municipality. Sharon will share with us her experience in implementing the model. So Sharon, our virtual floor is yours.
Hello, and hello to everyone. Good afternoon. First, I would like to thank for the opportunity I was given to take part in this webinar. About 26 years ago, I graduated from social work studies and began my professional career in caring for senior citizens in a neighborhood in Eastern Tel Aviv. Over the years, with the support of the mayor and in partnership with government ministries and various organizations, we have developed a diverse program for senior citizens on the continuum between universal services in the field of enrichment to programs for senior citizens in functional and mental decline. In March 2017, on a Saturday morning, an 80-year-old woman was sexually and physically assaulted while going for a walk with her dog, something she performed daily. It was 4 months after I started my role as the Director of Social Services Administration. Was this an extraordinary event? In some ways, unfortunately, no. But we are witnessing incident of violence against senior citizens. For me, it was a moment of truth in which I sought to re-examine our goals in caring for senior citizens, to take broader look through wider lens. My mayor and municipality director general immediately support this request, but asked me to bring something new, something broad. I realized that a groundbreaking process was expected from me and my staff in this area. I started checking who could help me to lead a change. Thanks to a very good friend of mine, I very quickly met Mr. Yossi Hyman. Prior to this meeting, the administration had worked with JDC Eshel for years, implementing plans developed by Eshel. The meeting with Yossi and then with his staff generated a substantial positive change for the citizens of our city. We have moved from micro process of addressing specific need to a macro course that examine the quality of life of citizens in relation to increase in life expectancy and to component of health and urban life. I must say that as one has just started her position several months earlier, I quickly felt a great professional confidence in this process that stemmed from JDC Eshel, vast knowledge, and the professional and in-depth accompaniment we gained. The substantial process that has taken place in recent years with JDC Eshel allows us to produce in-depth integrative evidence leading to substantial change, wide application for renewal and innovation. And I'm going to speak about it in the few next seconds. So the administration in Tel Aviv-Yafo is focused on two main issues. The first one is social services, and the second one is public health. And our vision is based on three topics. The first one is developing group, personal, and community resilience. The second one is reducing social gaps and promoting social justice. And the third one is providing universal services to all city residents. And our main challenge is moving from output to impact, of course. Some basic data about elderly citizens in Tel Aviv-Yafo. More than 79,000 citizens are by the age of 65 and more. 30,000 from them are by the age of 75 and more. 11,000 are childless and 12,000 use social services. So I would like to address the cooperation between JDC Eshel and the municipality of Tel Aviv-Yafo through 4 key issues, as you can see here, and I'm going to speak about each of them. So the first key issue is developing and implementing multi-system and inter-organizational approach. And as Yossi mentioned before, Yossi talked about, of course, about Miuni-100, which is the last and the big example for it. But a number of government ministries in Israel deals with senior citizens. Each of them promote issues that are on its agenda. The leadership and integration that JDC Eshel leads allow the creation of common and comprehensive perception. And the main example, the recent one, of course, is Miuni-100. The second key issue is implementing programs developed by Eshel. And you can see here some examples, but JDC Eshel, many programs that we implement in our municipality were developed by JDC Eshel. And one of the major and recent one of them is the Up 16 Plus, which is a center for guidance and promoting of older adults.
Can I kindly stop you and just ask you to move your slides forward?
Oh, I moved them, but you can't see it. I'll do it again.
Yeah, thank you.
Sorry. Do you see it now? The goals?
Now I can see it perfectly. Yes, thank you.
Okay, thank you. So as I mentioned before, the recent one is the Up 16 Plus, which is a center for guidance and promoting of older adults. And you can see here the goals of the center, but I would like to pronounce that in 2021, more than 5,000 citizens in Tel Aviv-Yafo used the services provided by this center, and it is a huge success. Sorry. So the third key issue regards to implementing knowledge developed by JDC Eshel. The rising sense of loneliness in light of COVID-19 obliges us to use technology to increase communication and independence, to reduce loneliness by digital means for citizens who were unfamiliar with digital. Through the JDC Eshel knowledge in digital literacy, we were able to develop a digital solution in a very short time. And you can see her, an old woman, she was Holocaust survivor, and she used the tablet that we developed. And you can see here some of the comments, and you can see here some of the comments of citizens who are taking part in this program based on commercial tablets. And you can see one of them told us, "I'm no longer speaking to the walls. My life saved by this program. Daily life is more interesting, keeping me from being lonely." The second, and the first and last key issue refers to the professional accompaniment provided to us by JDC Eshel. From 2017, JDC Eshel accompany us in the process and programs we initiate in the field of aging. For example, research that we do in 2017 on quality of life, and we found the 3 components that are in regard to the senior citizens in Tel Aviv: employment, social connection and network, and of course, independent and mobility. The second example for this key issue is a new initiative called A New Age, or in Hebrew, Idan Chadash. It's a social impact bond or a pay for success project to reduce loneliness. Finally, I would like to thank Yossi Hyman and the staff from JDC Eshel from all they are doing with us in Tel Aviv. Thank you.
Sharon, thank you very much for the very insightful presentation. It's really interesting for me to see how things work behind the scenes. And now we will move to our last speaker, Mr. Gilad Hadas Handelsman, Director of Data and Research at JDC Eshel, who will showcase the supportive community model for optimal aging. So Gilad, our virtual floor is yours.
So hello everyone, and thank you again for the opportunity. I'm just gonna share my presentation.
Yeah, we can see it clearly.
Yes, excellent. So I'm going to talk today about disruptive technology for preventive geriatric care through the example of the supportive community model. Just an oversight what I'm going to talk about. So around the 1970s, the approach to aging changed from the institutional approach to the aging in place approach. And that's around the time that JDC Eshel was established to help develop services in the community. And one of those services developed in the community was the supportive community program that was developed in 1989, which I'm going to go into in the next few slides. But around 2019, when COVID-19 entered our lives and disrupted everything, we realized that the services needed the adaptation with an emphasis on the need for remote capabilities. And that's where we joined forces with an Israeli startup called Invisacare, which I will go into further down the line. So let's start in the beginning, supportive community. Like I said, a service that was developed in 1989, over 30 years ago, with the main mission of enabling older adults to age in place and receive accurate personalized care. We did this through four services that were given in the basic basket of services. First, helping with social connections through social activities, accessible health services through an emergency panic button, and a 24-hour physician that can come to the older adult's home within 2 hours, and home maintenance, which was given through a supportive community father or mother, which helped around the house with small maintenance issues. But beyond that, he or she, the father or mother, became like the older adult's confidant, which enabled the older adult to turn to and rely on beyond the formal services or the informal services of family members. And this together gave the older adults the safety and security to stay at home and actually age in place. Now, as the years went by, obviously more players came into the field, and the needs of older adults changed, and the rigid basket of services that was developed over 30 years ago became less relevant. So in order to stay relevant as a service, we understood that we needed to adapt and change. And what we did, we expanded the basket of services, but beyond that, we also made it flexible, enabling each older adult to choose whatever services are better fit to their needs. So you can see that the services were changed to higher engagement with the community father or mother. Again, the health physician with the panic button, more diverse social activities to adapt to older adults who can't leave their house, for example, paramedical services, transportation needs, groceries, and medicine delivery. But beyond that, one part of the ingenuity was staying within the same business model, within the same financial framework, of the older model, which meant around 200 households per supportive community, or 300 more or less older adults per supportive community father or mother. A fixed monthly membership, which didn't change between the older model and the newer version, of 150 new Israeli shekels, which is the equivalent of 35 to 40 euros. And to add to that, to make sure that, just to show that it's not a luxury service, over half of the members in supportive community get some sort of subsidization, up to 2/3, through the Ministry of Social Affairs. So this is a really important service-based, community-based service. But the idea of adapting to change was not only about changing the one rigid basket of services to another rigid basket, which will need to be adapted again in 10, 20 years. There was a change in the way that we were thinking. We were making it, the whole MO of the service change to be more flexible. So I talked about it being flexible from the participant side. So he or she could choose what services on a quarterly basis, he could change the services that he or she wanted, but also from the agency operating the service, there was more flexibility by giving tools, for example, a survey done once a year to analyze the satisfaction of the existing services and be on the lookout for rising new needs that might require services. And once a need like that is identified, giving the tools to build a business model that is sustainable. And the flexibility here comes to play in an example that I'm going to give it to you. The way that two different supportive communities in Israel approach the need for transportational services. So one supportive community, for example, turned to the local authority, which they had good relationships, got a vehicle and hired a driver, and then made sure that the demand for the vehicle was enough to, from a business sense, support and be profitable for the organization. And a different supportive community made a deal with a local taxi company for a minimum amount of rides with a subsidized cost. So each operating agency could adapt and provide the services to their own clients in a different way. So that was a supportive community 2.0. And now I'm going to show you, just to put a face to the model, I'm going to show you a short video about supportive community.
Hello, I'm Naftali. I'm the father of this community. I'm here at the Sapir family. Come with me. Hi, sir.
Hi, Naftali.
Hi, how are you?
Welcome. Good to see you again.
Thank you very much. Is everything okay?
Things are okay.
You can check the emergency button like we do every month or so.
Good idea.
Yeah, that's a good start. Hi, this is Naftali. I'm just checking to see if the emergency button works. The supportive community was developed many years ago. It's based on the principle that says we want the elderly living wealthy, healthy, and good life in their own homes. We deal with different religions, different languages, different cultures. We have a response for each one of them.
And Naftali, there are a couple of things
Okay.
that I'd appreciate if you could check.
Sure. It was loose. Try it.
Let me try it. There we go. The supportive community offers many services that we didn't have before. Here in the community, especially during the COVID crisis, no one felt alone.
To be a father of the community means that you have to work a lot from the heart. I treat them like I treat my own mother and father. No matter how lonesome you feel, no matter how ill you feel, there's always someone a phone call away from you that will take care of you. We are the eyes and ears of the social services, the municipalities. The data we collect all the time is especially important during emergency time. And of course, is used during normal times. I was trained by Joint Eshel. They have an extensive course, very good one. We enjoy the support of the local municipality, the Ministry of Welfare, and Joint Eshel.
The supportive community in this day and age, despite all the social networking, you need them for your self-confidence, for your own self-well-being.
All over the world need to have this model. It is sustainable, correct, and very needed for the elderly all over.
We're very lucky to have the community serving us.
So as I was saying, and also mentioned in the video, the supportive community is a service given in the community, a formal service that comes alongside the informal services such as family members. And this is to answer the needs of the individual in order to enable aging in place. But when COVID-19 entered our lives, it disrupted and changed the way that we work, especially in the sense of being able to approach the older adult and provide the services because of all the lockdowns and quarantines. And it was now more than ever that these older adults needed these services in order to age in place. And in order to bridge the gap that happened because of COVID-19, we joined forces with the Israeli startup called Invisacare and developed what we call Supportive Community 3.0. And now I'll show a short video to explain about the technology of Invisacare, which I don't want to go too much into detail because of time limitations, but more explain how Invisacare joined forces with the supportive community to develop the supportive community 3.0.
Invisicare's award-winning technology, in collaboration with JDC Eshel and leading communication companies, keeps parents' life totally private. It analyzes their use of television, cell and landline phones to notify us long before issues become painful problems. What does this give us? The system detects behavior changes that can indicate problems, such as decreased social interactions, loneliness, sleep disorders, decreased physical activity, and even possible emergency situations. It also alerts in cases of incoming suspicious fraudulent or just harassment calls. With Invisicare's Family Companion, you can relax knowing how parents are doing and always be there for them. And the great news? Invisacare has no physical presence. Parents feel safe with the guardian angel. They don't need to change their daily routine and struggle with apps or wearable devices. Invisacare is here to help you take care of your parents, even when you cannot be with them. Connect to your loved parents with Invisacare.
So in order to explain how Invisacare works a little bit, basically Invisacare is a startup that takes existing data from telecom providers and then obviously with the approval of the older adult, and then turns it into a, like the video said, into a behavioral model, and using algorithms and AI identifies abnormal behavior, which indicates some sort of need that requires an intervention. And then it translates these abnormal behaviors that it identifies into notifications or wellness recommendations, which it then sends out to the relevant service provider in order to provide that service to the older adult. So it could be to the community father or mother, it could be to the son or daughter, or any family, supported family member, or any other existing services in the older adults micro community. Now, this technology actually enables remote monitoring in that sense. And just maybe to sum it up, we're talking about a sensor-free product which uses blind algorithms to only identify abnormal behavior. It means it doesn't follow you around. It just identifies changes that are abnormal for each and every individual, using a very innovative privacy model, which again, I'm not going to go into right now. It's based on leveraging existing data. It means it doesn't collect new data, but it just leverages existing data from other providers in order to provide the service. And then it translates it into notifications and recommendations, which are then sent to the community surrounding the older adult in order to provide relevant personalized services according to his or her needs. Now, when looking at it from the full view of how it connects to supportive community, you understand that it's a win-win-win situation. Because when you look at the client, you see that we're providing a flexible, personalized basket of services, whether the older adult asks for it or the system notifies and maybe offers it to him to choose, and then it can really promote aging at home. From the supportive community point of view, we're talking about a real-time effective measurement tool that enables data-driven early detection and preventive intervention. Because when the Invisacare, the algorithm runs on the behavioral models, it can actually identify very abnormal behavior, which might be minute, way before it becomes a real problem. So it can see social isolation, for example, way before it develops into full-on loneliness. And this enables the community to provide real-time services in preventative interventions in the fullest sense. When looking at it from the service level, it enables an easy integration and synchronization with the existing community services. So if today something happens, God forbid, to my father, then obviously I have to call the police and maybe the emergency services and maybe the supportive community father or mother in order to synchronize everything that's happening. But then again, when I have this service, I'll still want to take care of my dad. But on the other hand, I also know that all these notifications are sent real time to all the different relevant service providers in order to provide that intervention. And obviously on an economic level, except for the fact that we all know that prevention is always more effective and cheaper, we're talking about a sustainable and scalable business model. that can be really be implemented relatively quickly. So for any further questions, or I'll be more than happy to answer. And thank you again for letting me present.
Thank you, Gilad, for the very insightful presentation. As I mentioned, all the presentations will be sent to our guests, including the video of this webinar, so you can watch it later or share it among your colleagues who could not join us today. I must say we are in a situation that I've never been before, which means concluding the webinar on time. Usually when you let Israelis speak, they just speak forever, not in our case. So I would like to take this opportunity and thank our speaker and also our participants for joining us today, given their very busy schedules. As I mentioned, you will have a clear line of communication with JDC Eshel, with Sharon from the Tel Aviv municipality, should you want to have any further information or any follow-up to this webinar. And on I would say, an ending note, I hope that you have found the webinar enriching and interesting. And as mentioned earlier today, we will share the information later on in order for you to allow you, our participant, to communicate directly with the different panelists. So on this remarks, I would like to thank you very much for your time, and I will keep you posted for future events. Thank you very much.